If you've recently had a total or partial knee replacement surgery performed by Dr. Oyer, here are a few things to keep in mind. Call Dr. Oyer at 815-398-9491 if you develop any of the following symptoms. After 5 p.m. or on weekends, please remain on the line until a representative answers your call. Due to the anesthetic you've had today, we recommend the following. Have a responsible adult drive you home and remain with you overnight. Expect to be tired for the first 24 hours. Listen to your body and rest as needed. Follow a light diet and drink plenty of fluids. Dizziness is not an unusual side effect the first day, and do not drive. You will be given a prescription for pain medication. Take the medication as needed. Most patients require pain medication only for a few days. Oral medications take at least 20 to 30 minutes to take effect. Common side effects include upset stomach and constipation. Drinking lots of fluids and eating foods high in fiber such as fruits and vegetables can help. You may also use over-the-counter stool softeners to help prevent constipation. While taking prescribed pain medications, do not drive a vehicle, operate machinery, power tools, or appliances. Do not make personal or business decisions or sign legal documents. Do not ingest alcohol, tranquilizers, or sleeping pills, and do not exercise unless given special instructions. You may advance your diet as tolerated, starting with liquids or soup. Next, try semi-solid foods such as mashed potatoes, applesauce, or Jell-O. Slowly move to solid foods, avoiding fatty, rich, or spicy foods. And do not force yourself to eat large meals. Nausea and or vomiting after surgery is common and can last up to 72 hours. It's important to follow diet suggestions and take prescribed medication like antibiotics, narcotics, or anti-inflammatories with food. Some suggestions to help nausea include keeping your pain under control, drinking plenty of fluids, aromatherapy, but avoid strong scents, and ginger candy or ginger ale. You will also be given medication to help with nausea and vomiting. Perform activities as tolerated using a walker or cane. Be mindful of resting. No lifting more than 25 pounds. You may climb stairs after being cleared by physical therapy. Do not drive until you're cleared by Dr. Oyer. Apply ice to the operative knee 24 hours a day for the first 48 hours. Then 30 minutes at a time, 4 to 5 times a day. Use a cane, walker, or crutches as determined by physical therapy. Formal outpatient therapy will begin shortly after surgery. If this is not set up yet, you will be receiving a phone call shortly. To help prevent blood clots, change position frequently and keep your legs active by flexing your thigh muscles and pumping or rotating your ankles 3 to 4 times daily. Call your doctor if you see any unusual swelling, redness, or tenderness in the calves. You will also be taking medication to help prevent blood clots. Use your incentive spirometer as instructed by the postoperative nurse. This will help prevent pneumonia. Take deep breaths and cough throughout the day if needed. Call 911 if any sudden or persistent shortness of breath occurs. Keep the incision clean and dry. Do not shower for 2 weeks. Do not soak the dressing or the incision area. No swimming or use of a bathtub until you're cleared by Dr. Oyer. Keep the incision covered with the dressing that Dr. Oyer placed on your leg during surgery for at least 7 days. You may then keep the incision covered with a dry gauze pad that may be changed every other day. Gauze supplies can be purchased at the store located inside our clinic building or at any pharmacy. Do not use lotions, creams, or gels to the operative area. Wear compression stockings as much as possible on both legs for 6 weeks. Please review your current and new medications listed on your post-op instructions. Instructions will be included if any medication should be held or discontinued and for how long. If you have any questions, concerns, or if you need to schedule or change your follow-up appointment, please send us a message on the Ortho Illinois patient portal or call Dr. Oyer's office at 815-398-9491.